So discussing this is always a little bit of a loaded question. So full disclosure, all the ways to become a plastic surgeon produce fantastic plastic surgeons. I'm just going to tell you why I value general surgery and what I feel it gave to me. So for those of you that don't know, there's two ways to do plastic surgery. The traditional way is the way I did it, where you do a surgical residency first and complete that, and then do a fellowship afterwards. The newer way, which is what most programs have transitioned to, is integrated or combined, where you match directly into plastic surgery and you are in plastic surgery the whole time. So you do more time in plastic surgery in the second method, but you're starting as a younger resident. So as an older resident who is already a chief in a surgical specialty, you learn faster and you have the ability to learn faster because you have a surgical skill set already. Both ways are great. Now, I personally really loved my general surgery training. I loved all of it. In particular, I loved trauma, transplant, and vascular. Those were probably my favorite subspecialties. But I think general surgery is a field where you learn how to care for extremely ill patients. I did 11 dedicated months in the surgical ICU, and I had ICU patients on my service the entire time I was a resident. And it makes you a really good doctor. Now, the reality is, as a plastic surgeon, I rarely have critically ill patients where I'm the only doctor managing them, but I could. And I love that I have that skill set. So when you look at how you manage patients, whether you're a junior resident or a chief resident, a junior resident, you are part of the team, but as a chief resident, you're running the team. And I think that the skills of running a team in a general surgery environment were very valuable to me. And again, I think it just makes you a great doctor. Now, the way that medicine is going is that everyone's kind of becoming a specialist. There's not a lot of general anything anymore, even in the field of plastic surgery. There's many other surgical subspecialties that are going to this type of training where you reduce the years and cut off the end of general surgery. Vascular surgery has done that. Cardiac surgery has done that. And I think with the changing medical environment, with the complexity of the different fields, it's probably for the better, but I wouldn't give my general surgery training up for anything.